For 6 weeks, in the middle of a global pandemic, during a surge in coronavirus cases, Idaho's most populated health district has been without a physician on the board, and it's not going to have one for at least another week. It's not just COVID. Other respiratory illnesses are starting to peak now, too. Midsummer instead of midwinter. We're learning why RSV has put a lot of kids in local hospitals. 3 shootings involving Boise police in less than a month. Boise's mayor is now calling for body camera video to be released. But that would take cooperation, and that's not coming so easily.
And so I think that we can see the writing on the wall that Commissioner Davidson is going to make a motion to nominate Dr. Cole. I would make a motion to not nominate Dr. Blue. And I'm not sure you'd second either one of those. I'm going to make a motion to table the appointment of the CDH appointment to
Oh, it'd be the 17th. Sorry.
17th,
to
excuse me.
to next Tuesday, the 17th, in order to give this board a little bit more time to reach back out to the public that lives in the 4 counties and get feedback, and also to the 3 potential appointment nominees here.
So, 41 days of gathering information, considering candidates, combing through thousands of emails of public opinion, and 90 minutes of interview, the Ada County Board of Commissioners decided today to not decide who would fill that physician position on the Central District Health Board, a spot that has remained vacant since June 30th, when they notified Dr. Ted Epperly his services in that spot would no longer be needed after 15 years. The decision to put it off a week was made after it became obvious, as you just heard, a selection today wasn't going to come so easily. The commissioners were entrenched in their camps, and they likely weren't going to move. And once again, like during yesterday's interviews, those polarized stances were put on us, the media. Perhaps summarized best by Commissioner Rod Beck, who said replacing Dr. Ted Epperly wasn't about politics at all.
And the local press just went berserko, saying that we sacked him or squeezed him out, things like that, which we didn't. I went and looked through my records, and I couldn't see a single spot or anything where Dr. Epperly had even wanted to be reappointed. I mean, maybe he did, I don't know, but he didn't notify me. I don't know if he notified you or you, but I didn't see any notification there.
How about if we just ask Dr. Ted Epperly about that? Did he not want to be reappointed? Were none of the commissioners notified of that?
Untrue. I know for a fact that Russ Duke, the director of Central District Health, had talked with the county commissioners multiple times about continuing me on in the role of the physician member of the Central District Health Board. So it was conveyed to the Ada County commissioners by the director of Central District Health in regards to my continued interest in staying on CDH at a very important time for our public's health.
When he expressed that he wanted you to stay on the board, did you hear anything from the commissioners about that?
I did not.
Other than your letter of?
Yeah, my email. My email's entitled, Brian, thank you for your service after 15 years of dedicated service. But I would have thought that it would have been more professionally handled.
But we knew that 5 weeks ago, yet Commissioner Beck went on the record today to say just that. Well, another thing Commissioner Beck said today was his choice to be the next physician on the CDH board was going to be influenced heavily by whichever candidate had the best experience running a business. And he was disappointed. None of the candidates even looked at the budget.
Central District Health, that's one of the biggest things they do on the board is look at the budget. And that's why I was kind of looking for a doctor that would have some budget experience, that would have some experience with running a large organization. This position is for running an organization, as for and it's mainly budgets. I've talked to several of the board members. They talk about policy, but they mainly deal with budgets, keeping the organization in line with their budgets.
Is the budget a big part of being on the Central District Health Board?
I would say that the budget and its analysis as a one of the duties we do represents about 5% of the time we spend at Central District Health. Most of the budgetary items are handled by the staff. And what the board is presented with in terms of that would be the overall budget, how we're doing financially, and what the budget request would be for next year. That pales in comparison with all the other duties that Central District Health does. And let me just mention a couple of those. All sorts of policy work, public health functions around swimming pool safety, daycare safety, food inspections in restaurants, healthcare services to include to women, infant, and children around breastfeeding programs, infant nutrition, mental health programs, reproductive health programs, sexually transmitted disease tracking and treatment, different policies around sewer and septic items for the good of the community, both infectious disease control, but water safety, strategic planning around such things as obesity and the opioid epidemic. So that gives you a flavor accurately.
And that's a lot. That doesn't include budgets, which according to Dr. Epperly is only about 5% of what they do with Central District Health Board. The budget, which by the way is just under $12 million for CDH, is worked up by the staff, as Epperly just told us. The board is just there to give it oversight approval. So no, this appointment is not really about budgets, at least according to Epperly, and at least it shouldn't be. Nor was this appointment made political by any outside forces. How this appointment should be made is probably best summed up by what Dr. Epperly said at the end of our chat today.
We're sitting kind of in the lull before a huge fourth surge of COVID. The importance, I think, of getting the right person now on the board as the physician member may have huge impact in terms of the public health and the safety of the public in regards to infections, hospitalizations, ICU admissions, and death. This is not something that we should take lightly in the community. It's really an important thing.
That appointment is expected a week from today. And again, by that time, we'll have gone 7 weeks without a physician on the board of the most populated health district in Idaho during an uptick in a global pandemic. All right, well, speaking of making decisions, the military tends to make some pretty big ones. The latest is a top-down edict from the top brass. Even the chairman of the Joint Chiefs of Staff, General Mark Milley, called it a key force protection and readiness issue. Yesterday, the Secretary of Defense made it known all active military members will be required to get the COVID vaccine beginning next month. And that includes all active airmen stationed and serving at Mountain Home Air Force Base. Saying they've received the message about the vaccine mandate per presidential approval, the 366 Fighter Wing is prepared to vaccinate all Mountain Home Air Force Base airmen once directed. COVID vaccines help protect the health and safety of our military members and their families, which improves the Wing's readiness to accomplish its mission at home and abroad during the ongoing pandemic. The plan states the mandate will go into effect by mid-September or immediately upon FDA approval of the COVID vaccine, whichever comes first. And the Pfizer vaccine is on track to get that approval in the early part of next month. And of course, this has led to a lot of people, including elected leaders here in Idaho, to question the vaccine requirement. None other than our own lieutenant governor claims it will damage morale and asks why we ask our troops to defend our country, but we don't trust them to make their own medical decisions. Probably worth pointing out, you don't get to make too many of your own medical decisions if you sign up for the military. If you've served, you're probably familiar with the term voluntold, right? As far as vaccines go, here's the breakdown of what is already required for active military members, according to the military health system. There are 6 areas of command from North America to Africa across the globe. And depending on where you are sent to serve, you are required to get a dozen or more vaccinations, some with multiple shots. For example, being sent to Korea under the Indo-Pacific Command, you are required to get 13 vaccinations, all of them listed right there. Hep A and B, polio, typhoid, rabies, encephalitis, and of course anthrax, which has its own story of its own. We're still not sure how many this mandate would directly affect at Mountain Home Air Force Base. How many have already been vaccinated versus how many haven't yet. But if getting a vaccine against a raging virus during a pandemic with all the other vaccine requirements already in place, if that's all it takes to damage morale, it might be hard to argue that it's not because of politics. This respiratory virus all but stopped spreading among young children during the pandemic. Now, RSV is spreading across the Treasure Valley at an alarming rate. All right, before we get to that, let's talk about what's going on with you. Text us your comments and questions about today's topics or what we could talk about on another day. Our number is on your screen, 208-321-5614. Just be sure to include your name and the hashtag the 208. Oh, and we're going to share a few of those texts at the end of the show. All right, one thing health experts have noticed over the past year or so, with a lot of people keeping their distance from each other and wearing masks when they're out, when they couldn't keep their distance. Weird, we saw a decline in other respiratory viruses, fewer flu infections, not as many cases of the common cold. According to the American Academy of Pediatrics, reports from around the globe showed there was a 98% reduction in respiratory syncytial virus during the pandemic. That's otherwise known as RSV, and it usually hits children younger than 2. Serious cases can put kids in the hospital. So anytime we see a decrease in those possibilities, well, that's a good thing. However, as things begin to open up and people have started to gather again, experts are now seeing a peak in RSV cases in Idaho. And that's unusual for this time of year because it's usually a winter season sickness, but it's not really a surprise to see this uptick. Here's Katya Stepovic.
Throughout the pandemic, some families may have noticed that their kids didn't get the typical flu, seasonal cold, or annual RSV.
During the times that we would usually see RSV, which would be, January, February, March, people were still social distancing and they were wearing masks. And so the virus wasn't spreading during that time.
Last year, when people were, I think, particularly cautious and careful, we went 8 months without seeing a single case of RSV, where we usually see 1,000 cases that need to be admitted to the hospital or who need to be seen regularly over the course of a few days. We saw 0.
The American Academy of Pediatrics says RSV, or respiratory syncytial virus, sends around 57,000 children ages 5 and younger to the hospital each year, with around 500,000 ER visits. But this year, seeing typical peak months with very little case counts gave medical experts hope until now.
Usually July and August, we don't have any RSV patients, and we have many in the hospital right now.
Beth Cleveno, a pediatric hospitalist at St. Luke's, says that's most likely because social distancing and masking practices have eased.
So we're getting a combination of winter viruses, COVID, and the usual summer illnesses that we see. And all those together lead to a higher census on the floor.
While only 2 to 3% of RSV patients get admitted to the hospital with bronchiolitis, which is inflammation in the lower airways, the concern is now having available room to treat those patients. Just 2 weeks ago, the pediatric floor at St. Luke's was at full capacity.
We had to hold patients in the ER for a longer time, and we did have to transfer patients out of state. As a parent, I think that'd be extremely difficult, and I wouldn't ever want to turn anybody away because we don't have enough capacity.
But if RSV and COVID and seasonal illnesses continue to spread, transferring pediatric patients outside of the state could once again become a reality.
I do think it's possible at some point, and that's why we're all discussing right now what can we do between different institutions to try and keep the patients here in Idaho as much as possible.
RSV is also spread by respiratory droplets, so to avoid it, strict hand washing, avoiding large crowds are a must, and of course, masking up.
Right now, we're getting multiple illnesses coming together that don't usually show up at the same time. So if we're getting pediatric COVID, pediatric RSV, other pediatric respiratory illnesses, and like I said, our usual summer stuff like gastroenteritis and trauma, then that's a large number of patients all at the same time, and that puts a strain on the system.
Okay, Katya, so we know the kids under 12 cannot get the COVID vaccine right now, but what's the impact if they get COVID and RSV at the same time?
Well, Brian, that's a great question. And Dr. Cleveno says that they've only seen a couple of patients infected with both respiratory illnesses at once. And there's still a lot of information needed to be gathered. But she says it's very possible that the impact can be more severe simply because they're dealing with two effects of two viruses at the same time. So it's simple. She says, if you want to keep your kids safe, get vaccinated.
All right, I'm still stuck on that number by Dr. Bramo, where they went from 1,000 cases of RSV to 0 in a matter of months. It's still amazing. All right, thank you very much, Katya. All right, aside from the pandemic, we've learned another important lesson over the past year and a half: the value of having video of a controversial interaction between the police and the public. Body camera evidence has been the point of focus for a lot of communities the last few years, especially those incidents that involve an officer firing their weapon. After 3 incidents of Boise police officers firing their weapons in about a month, Mayor Lauren McLean is now speaking out, saying she wants to improve the process of holding people accountable by releasing the officer body camera video from incidents for people to see. Important to note, all 3 of those incidents that we just mentioned in Boise are still under investigation. So will body camera procedures in Boise soon change? Well, some fear that could jeopardize active investigations. Joe Paris gauged the debate today, checking in with Mayor McLean, Boise Police, and the Ada County Sheriff's Office for their perspective on this continued conversation.
From June 27th to July 24th of this year, Boise Police had 3 separate incidents that involved an officer firing their gun. BPD hasn't had 3 such occurrences in a year since 2017. All 3 2021 incidents remain under investigation. In response to the recent shootings, several members of the community spoke out online and in protest, requesting that officer body camera video from the incidents be released. Boise Mayor Lauren McLean sent a strong message to the community, saying in a statement that she agreed.
We want to ensure that the desires of our community are reflected in our request, and that is to provide transparency, maintain community trust. So we asked in partnership to release the videos.
In her statement, McLean said on Friday that she sent a letter asking Ada County Prosecutor Jan Bennett to allow the city of Boise to release the body camera footage from all 3 recent shootings to the public.
This is a really important tool for transparency and accountability, and to ensure that our community retains the trust that we enjoy between our residents and our police officers. Everything we do is aimed at keeping our community safe, maintaining that trust. And to maintain trust, it requires that we be transparent and accountable.
I reached out to the Ada County Prosecutor's Office for an on-camera interview to discuss this topic, but was told that she is unavailable this week. The prosecutor's office did issue a written statement in response to Mayor McLean's request, saying in part, release of evidence, including on-body video footage, not only undermines the investigation of Ada County's Critical Incident Task Force, which is comprised of law enforcement agencies across Ada County and the Idaho State Police, but it also undermines constitutional due process and the Idaho ethical rules. Premature release of any evidence in criminal investigations violates the due process rights of those who may be charged and prevents a fair trial. We will not be party to impeding the pursuit of justice. So, how does the Boise Police feel about the debate? Well, in a media roundtable with area reporters last Thursday, Boise Police Chief Ryan Lee said, quote, I'm having conversations with my colleagues about how we can more rapidly get to a place where we can release video. Again, I have to weigh the investigative and prosecutorial concerns and wishes in making that decision. It's not one I can unilaterally make. During that same event, Chief Lee was asked about BPD's relationship with the Ada County Prosecutor's Office in regard to releasing video after an incident. Specifically, if BPD wants to release a video, can the prosecutor's office tell them no? Chief Lee responded saying, quote, I think there is some subjective debate over that. In response to the statement from the prosecutor's office, Mayor McLean says that she wants to continue the conversation.
Well, we will continue to ask for partnership, seek partnership. It's so important, not only for the public, but for the police department, and seek ways to ensure that videos are released.
All right, Joe, states have laws in regards to body camera video and such, and they vary from state to state. What does Idaho's look like? Do we even have any?
Yeah, so the state of Idaho actually has nothing in state statute that says after an incident, body camera video needs to be released, after X amount of days. The only thing that really is in state law involving the body camera is really how it does to do with evidence. Of course, body camera video is evidence, and there are state statutes about not necessarily releasing evidence and not releasing evidence, but preserving that evidence for trial, for future events, to make sure that the evidence is preserved, to make sure it can be trusted. That's really the only thing in Idaho law. Now, there are laws in states like California where you have 45 days after a certain point to get body camera out in specific situations. So there are pushes across the country, Brian, in several states that say we should probably be like California and at least consider options on should we make them get video out quickly or after
within a certain amount of time, right?
Yeah. So we haven't seen that here. It's possible we could see that at the state legislature at some point. I haven't heard a lot of pushing for it in recent years in terms of serious legislation down at the State House. But again, when we have conversations like this between the prosecutor's office, the mayor's office, of course, Boise Police involved in this as well, that could be the ball that gets something rolling. But you have to consider that there are a lot of considerations considerations when you do release body camera video, because again, it is evidence, and there are prosecutors, like we heard here in Ada County, that are concerned about the integrity of the judicial system.
Yeah, and what we learned during an investigation is very hard to come by, as we've learned over the years. I mean, conversations are hard to come by. I can only imagine what body camera video would be, what that would take. All right, thank you very much, Joe. All right, final moments here for your comments. Let's get to this one from Doug, who sent us a long one, so I'm going to kind of paraphrase it a little bit. He's basically saying he was in the Air Force for 19 years, and it's called Worldwide Ready to Deploy. It starts in basic training, and he's talking about vaccinations in the military. They use an air gun to give you your shots there. Back in the day, it was no big deal. You just got the shot, and you're ready to go wherever you needed to go. Man up and get the COVID shot, says Doug. All board of directors I've ever been on makes decisions based on staff recommendations. Beck is on a fishing expedition, so his candidate gives the appearance of an excuse, says Lori. How about this one? I like this one. If picking a physician for the health board is not political and the board is at a stalemate for picking a new one, why not just invite Dr. Eberly to return?